Everyone is magnesium deficient.
This confusion isn't just in the medical world with your doctors. I have seen it in the functional medicine space.
I'm not trying to be politically correct. It's just dumb to test for that.
If any woman or man is prescribed iron, they give ferrous sulfate, which is the worst imaginable form of iron out there.
Takeaway here is if you go to the hospital, have somebody there with you. Have somebody there with you who really cares about you and wants the best for you and is willing to stand up for you. And know that you are not a prisoner.
To Herbalism Uncensored, the podcast where we dig deep into the world of herbalism and natural healing. I'm Alicia.
And I'm Lila. We're two clinical herbalists who recognize the need for honest and authentic conversations about the state of natural healing today. As practitioners, we feel called to have uncensored discussions about why people aren't finding relief and what to do about it.
If you're frustrated by lack of results, overwhelmed by conflicting advice online, disillusioned by the commercialization of wellness, or simply passionate about natural healing, you're in the right place.
This podcast is our way of cutting through the noise, busting myths, and challenging marketing gimmicks.
This is Herbalism Uncensored,
where together we're nurturing the future of natural healing.
The contents of this podcast are for informational purposes only and are not intended to be a substitute in any way for professional medical advice, treatment, or diagnosis. It's important that you always seek the advice of your physician or other licensed healthcare provider with any questions or concerns you may have regarding a medical condition.
All right, we're rolling. Welcome to this week's episode of Herbalism Uncensored, where we're like, what the fuck, medical industry?
I didn't know you were going to drop an F-bomb. I wasn't prepared for that.
Oh, should I have said WTF like I was 12?
You're a millennial like me.
No, I'm on the cusp. We use whole words.
Oh, yeah. I got to work on that. So I will preface this with I've spent a lot of time over the last couple weeks at the hospital and in a nursing home with family members and talking to people of the world and clients, and just I think all the amount of medical what the F-ness, I don't know how else to say it, has just kind of been built up. So we decided we're going to do an episode kind of talking about a lot of the things that we see that are just like make you want to pull your hair out, because the system is so big and so bought into, yet some of these things just make no sense.
Yeah. And also, we talked about just prefacing this with, because we had some discussion, we don't want to just come off like we're just complaining. My hope as we go through this is that we will, one, maybe validate some people who feel the same way we do about some of these things, and two, offer some viable alternatives to some of the things that happen when you go to the doctor that just don't make any sense. I don't know. My clients tell me some things about some of the experiences they have, and I can't comment on them, but I think, that doesn't make any sense. And I've also done a lot of patient advocacy in hospitals over the years. A lot of the things that go on and conversations that I've had with nurses and doctors just don't make sense.
Make it make sense.
Make it make sense.
Yeah, we're going to try and weave in some wisdom and some practical takeaways throughout this, so you have nuggets and we can not just bring up the problem, but also explore the alternatives.
Okay. So we're talking about hospitals. First off, wait, go ahead.
All automatically, the first thing you bring up hospitals, you got to talk about the food.
We got to talk about the food.
And we're using the term food loosely.
Yeah, it's not really food. Oftentimes, it's not really food. Hospital food is built for safety, cost, and consistency. So tell me, like, what kind of things did you notice when you were in the hospital? What made your toes curl?
I'll tell you. So I was with a dear family member who was post-stroke and in a very vulnerable state. And one of the things that gets brought in her hospital tray every day is an Ensure protein drink. And the Ensure protein drinks have the macronutrients you're looking for, right? They're really calorie dense. There's a lot of protein. There's some fat. You're getting carbohydrates. So it's this macro balanced meal, but when you look into the ingredients, the first three ingredients on the protein shake that they were giving someone post-stroke was canola oil, corn syrup, and sugar.
Bunch of
And those are like three of the most inflammatory things you can do for your brain.
yeah, have some brain inflammation post-stroke.
It's just, it's not that these, it's not just like the lack of nutrients is the problem. It is the things that are actively working against the healing process that just, I don't even know if it makes me mad or if it just like makes me sad inside. Like I feel it makes me sad.
Yeah, I think this is just one place where hospitals doing a huge disservice to their patients. And it's not just their patients, it's also their employees and people visiting the hospitals. There's no healthy food to be had in a hospital. I know that when I was in the hospital last year with my grandmother, who is like very nutrition conscious, and she wasn't post stroke, her mind was still working just fine. She had open heart surgery. And so one of the things that she couldn't have was butter. And they served her scrambled eggs for breakfast with margarine. Margarine's not food. If you leave it in the woods, the bugs will not eat it. That's just like one way to tell that it's not food. And she wouldn't eat it. She'd kind of like open it, look at it, put it to the side. She was like, why are they giving me this? But the whole thing is, to me, I know that hospital management makes a lot of money. This is a huge industry. And it just seems misaligned that they have the money. They could serve people fresh food. I'm thinking post stroke, like I want to give somebody a bunch of healthy fats and green vegetables. How about a green smoothie with some pea protein? And there's absolutely the resources are there to serve that, and yet they don't. They could pay the staff to do that. They could buy those products, but they don't.
Yeah, it's really unfortunate. So after hospital, there was a skilled nursing facility, and one of the people I was with a couple people in the facility, got a UTI, and they brought a cranberry juice, and they bring diet cranberry juice, and it's got red dye, it has aspartame, it has sucralose, it has very, very, very little real cranberry juice in it. I think it was like 7% cranberry juice. The rest was just red sugar water. And it just blows my mind. I'm like, oh, cool. They're using cranberry juice for UTI. And then the execution on it really left something to be desired. Luckily, the lady I was there with was, I don't drink diet anything. Get that out of here.
Uh-huh.
But it's just, what are we doing? Again, the red dye and these all artificial sweeteners that directly have an impact on our brain and our neuroactivity.
Yeah. Yeah. And this is a real problem. This isn't just like you and me being health nuts and finding problems where there aren't any. They did some menu audits in, I think it was in Canada, and multiple center menu audits documented imbalances. They had high energy saturated fat and high sodium with low fiber and low micronutrients. And other studies show that menus frequently fail to meet protein and micronutrient targets linked to recovery. So the food is not designed to help people recover. It's not designed to help people heal. The reason for this is that there are multinational contractors, Sodexo, Compass Group, Aramark, that dominate institutional dining. Their business model historically relies on manufacturer rebates and allowances that reward volume purchases from specific brands. So the whole thing is designed where the hospitals purchase bulk, shelf-stable, ultra-processed foods that are going to sit there as long as possible, cause the least loss as possible, and they're not concerned about the kind of nutrition that the patients are getting. When we know that your body is a self-healing organism and it will heal when you give it the right resources, and we put people in these ultra-stressed situations, no one's in the hospital because their body is functioning optimally. And we don't give them the resources that they need. And the other thing is that, what was it that they found that when hospitals flip their procurement standards to health forward, their sales don't tank. Like they still have the same number of people in the hospital buying food. So keeping the junk is a choice. It's not destiny. It's not the way things have to be.
And I'm not surprised about any of that information about how and why we got here. I think that's really fascinating to bring to the forefront. And I also will add that when you're in the hospital, when you're recovering from something major and something stressful, you are in such a vulnerable state, and that period of time really matters for recovery. And it can make or break how far complete you do recover, depending on what you are or aren't doing. And it's not just, oh, put up with it and you can get to the healing part later. That is such an opportune time to do the things. When my dad was in the hospital 2 years ago, we brought him all his meals, broths and teas and soups, and we're like, you're not eating the hospital food. And I've had doctors be like, good, don't let him eat the hospital food. If family is willing to bring in other food, do that. You have a much better chance, which is very disheartening that even the doctors are aware of it and what a big problem it is.
Well, and I think that this is touching on patient rights here. I think having family with you in the hospital is so important, or having someone there to advocate for you, because people can't do this when they're sick. And the fact is that even though you're sick and you feel like you have no choice and you have to be there, that doesn't mean that you forfeit your rights when you walk through the door. You have a right to choose what you're going to eat and what you're not going to eat. You have a right to choose what medicine you're going to take, what medicine you don't want. You have a right to choose under whose care you're under. Like this isn't about food, but I'm going to jump on over to the idea of the hospitalist, because now they have hospitalists. You have your primary care physician who knows you long term. But once you check into a hospital, now you're under the care of the hospitalist. And your primary care physician can call in medication for you. The hospitalist can say no. But I happen to know this. I had a situation when my grandfather was in the hospital. His primary care physician called him in a specific medication, and the hospitalist dropped the dose to a tenth of the dose that his primary care physician, who knew him and had a better idea of what he needed as an individual, had ordered. And when they got the medicine and it was a tenth of the dose, my grandmother, the nurse, said, "What's going on here?" And they said, "We're not dealing with this hospitalist anymore. We are no longer going to be under his care. We don't want to receive his services. He's fired." And the nurses said, "Well, have you asked him?" The nurses were not aware that it was within the patient's rights to fire the hospitalist. And you have a right under to say whose care you're going to receive. And so once he let go of the hospitalist, for the remainder of his stay in the hospital, his primary care physician was in charge of what medicine he had. Now he's got a primary care physician who will answer the phone. That's why hospitals use hospitalists, because the hospitalist is on a shift and he's there. He can't fire him from the hospital. He's still at the hospital taking care of all the other patients. But it's the same thing with our food. They can have hospital rules that you can't bring in food, but as a patient at the hospital, you can say what you're going to eat. You can say what you're not going to eat. They can put you on a restricted diet and you can say no. And as long as we continue to, as patients of these institutions, to go into the hospitals and to just say okay and accept treatment that is subpar, will continue to get treatment that's subpar.
Such a good reminder that you can advocate for yourself, and that you can't, you have to advocate for yourself in those situations. And it's 100% worth it. Don't feel like you're being difficult. It's your health, it's your life, it's your body, it's your recovery, and these things make a big difference. So if you are post-surgery or healing or in any sort of recovery situation, whole, real foods, antioxidants, eat the rainbow, easy to digest, warming, just nutritionally dense foods is the way to go.
Here, here.
I after spending a few days at the hospital, I started like laying in bed awake, not being able to sleep because I was just like fantasizing of what integrative care could look like in this sort of setting. And I was just, what if the food was homemade and real food, and they were getting kitchery and soups and gruels, and it was all just very nutritious, and every patient got a full body ghee massage every day, and there were herbs being used, and nutrient statuses were taken into consideration. Give the lady who's post-stroke some magnesium. Let's start doing the things that are going to get her back to baseline. And we're just so far out from that. I mean, like, how cool would it be if you had hospital rooms that could, have different color palettes to bring in color therapy, and instead of TV on the wall where you could put on the news and just be a grumpy grump in the bed, it's healing music. We're like playing Beethoven. It would be such a different environment. I mean, like, we need some plants in
you're
there. We need
dreaming.
like a water fountain. I'm in fantasy land, but imagine what a healing space that would be. Hospitals are so uncomfortable. They're ugly. The color palettes are terrible. There's beeping everywhere. You can't heal.
That's what I would say, that like everything that you're saying, I agree. Wouldn't it be wonderful if there was a massage therapist that came in, and acupuncture and color therapy and music? But as you're saying this, I'm like, how about if we start small? Just let them sleep through the night. How about don't come in at 3 a.m.? Can you schedule the chest x-ray not at 3 a.m.? When I was in the ICU with my grandmother for 7 nights in a row, between like 3:30, they'd come in, and then that was like actually right around the time that she was able to fall asleep. It's my super high vata grandma drift off to sleep right about 2:30 with all the beeping and all the lights. So we do our best to get it dark in there and as quiet as possible. And she'd talk from 10 to 2 and drift off to sleep. And then at 3:30 in the morning, they come and wake her up for her chest x-ray. And I understand that chest x-rays post-heart surgery are preventative, and this is good data collection. But why are we collecting data at 3 a.m.? Could it be because during the day we're taking x-rays of people who aren't in the hospital, and we don't want to pay an additional employee to take x-rays during the day? We want to make that, we have that room in the hospital where we do the radiology, and we want that room working around the clock. And if that's at the expense of the rest of the people who are recovering from being 75 years old and having their chest cut open, we as the hospital are okay with that.
I never thought about that being the reason, but yeah, like all the MRIs happen at past 11 p.m. It's like MRI after hours.
Hospitals have managers the same way malls have managers. And it's a business, and it's about maximizing profits. And there's a lot of misaligned incentives that reward maximizing profitability, but patients pay the health price.
Mm-hmm. I don't even know if it's a rabbit hole worth getting into, but then you have this added layer of insurance companies dictating care, and insurance companies do these things where post-stroke, the chances that you're going to have a seizure are like 10-15%. So they preemptively put everyone on anti-seizure medication post-stroke
Just
as standard
horrible
care.
side effect. Horrible.
Horrible. Like, maybe did more damage than the stroke itself. Horrible. But it is cheaper for them to proactively give out anti-seizure medicine than deal with seizures that happen in that 10 to 15%. Because it's a cost-driven decision. And for those other 85-90% of people, their health suffers for it. It's infuriating.
Yeah, that's what, If we want to like really risk getting canceled, we can talk about insurance companies for a whole episode one day.
It's not the insurance companies that listen to us.
No, insurance companies are not listening to us, but they might be paying YouTube or paying somebody that pays YouTube.
Paying someone. There's money going somewhere.
So, yeah, man, I think the takeaway here is if you go to the hospital, have somebody there with you. Have somebody there with you who really cares about you and wants the best for you and is willing to stand up for you. And know that you are not a prisoner. You do have rights when you go in there. Be nice to the nurses. They're doing the best that they can, working in a system that is really hard to operate in. And don't think that just because the hospital sells it or the hospital's doing it, that it must be fine. We always have to exercise our critical thinking skills when it comes to our health.
100%. And I don't think it's a bad idea to have a health advocate designated should you get in an emergency or some sort of hospital situation. So
Oh, you're mine.
there's somebody, you're mine too.
Yeah, I'll pay your airfare. If something happens, you need to come.
Yes. And honestly, Alicia, I don't know who else it would be if not you who would come down and put me on the herbs and care about the food. It's such a skill, and also it takes a certain you need some chutzpah to advocate for these things and smuggle in tea to the hospital.
Yeah, I have smuggled in tea. I will smuggle in tea. And it's not as hard to smuggle in as you might think it is because the nurses and the doctors are often like, oh, what is that? Oh, it's some Chinese tea that's good for your heart. Okay, fine. They have rules that you can't bring food and outside food or drinks in because they don't want bacteria. They're worried about bacterial infections and things like that. But they know what's going on.
Oh.
Are we moving on? Should we move on to ferrous sulfate?
Yes, because this has been coming up a lot lately for some silly reason. If any woman or man is prescribed iron, they give ferrous sulfate, which is the worst imaginable form of iron out there. That's the one that causes constipation and nausea, and it's poorly absorbed, and you feel miserable on it, so you don't take it, and you remain iron deficient when there are so many better alternatives out there. And we know this isn't fringe underground information. These aren't like our niche natural healing opinions. This is like firm.
This is oftentimes when you're prescribed ferrous sulfate, they will prescribe a stool softener with it. You get Colace with your ferrous sulfate, and they dispense both of them from the pharmacy because they know that it's going to make you constipated. This is not, we're not making this up. This isn't, oh, you crazy herbalist over there. What do you want us to do? Drink Yellow Dock? No. It's just that there are multiple forms of iron, just like there are multiple forms of magnesium, and they're all absorbed differently. And ferrous sulfate is like the medical industry's iron of choice, and it's the worst one. You're talking like rock hard stool. That's what you're going to get.
It's cheap, but like none of the irons are expensive. So is it cheaper than having to do the iron plus a stool softener? There are plenty of very well tolerated irons out there that your life would not be miserable and you would be willing to stick with your iron regimen.
I almost want to call CVS like right now to see if they even have like iron glycinate at the pharmacy, because I know you can buy it over the counter, but I don't know if you can get it from a prescription. So maybe that's the case, because it's always better if your insurance can pay for it. Lots of times for people, something like that would be free, or $3 or $10 with their insurance. But yeah, other irons are not, iron's not like a crazy expensive supplement to buy over the counter.
I'm taking iron right now, and it's $10 for a 30-day supply.
You're taking the Hemoplex tablets now?
I am. And I've
That's
had
the one I like.
I had to play around with what iron works best for me, because I'm hypersensitive to those things apparently. And the slow release action on it has been super nice. I still do the low basma, so an Ayurvedic form of iron, and yeah, it's been great. I have my stools they're purple right now because I've been eating a lot of beets, but they're not black.
They're not black, and you're not constipated, and you're not throwing up after you take your iron.
No.
Yeah. Better tolerated alternatives exist. Our favorite is going to be the iron glycinate, that one. And we're particularly partial to the Hemaplex brand of iron, it's a multivitamin that has a whole bunch of iron in it and is food derived and well tolerated and not super expensive. Always listen to your doctor, but you can ask your doctor if you're taking iron, hey, what about this?
Yes, absolutely. I'm gonna skip around really quick and stay on the supplement topic right now because we have a magnesium problem as well with the medical model and how they test for magnesium levels. And it's just one of those things where, again, how did they get it so wrong? Like, we all have access to the same information. So if you ever go and ask your doctor to test your magnesium levels, they do a serum magnesium test. And your serum magnesium level is always going to be perfect because your body regulates it very, very, very tightly. Like, the magnesium levels in your serum, in your blood, have to be spot on or you have medical issues. So if you test magnesium in that way, it's always going to look like your magnesium is perfect, but it's not an indicator of how much magnesium is in your tissues or in other parts of your body. Magnesium is used in like over 600 processes in the body. And so if we look at this lab marker, it will never give us a good indication of how your magnesium is actually performing in the body. So they always test it and then think magnesium's spot on, don't do anything, when people are very, very magnesium deficient.
Yeah, everyone is magnesium deficient. So you get magnesium from green vegetables. So unless you are eating like 8 servings of fresh green vegetables a day, you're probably magnesium deficient. So the whole serum magnesium, and I get this, like, I have clients who come to me because there's a lot of buzz out there about magnesium and everyone's taking magnesium threonate. I think that was a couple of years ago, magnesium threonate got out there. The word got out about magnesium. I have been telling people to take magnesium for 10 years. Like, everyone needs magnesium. And now we all know that magnesium's a thing. So people will get labs from their doctor before they have an appointment with me, and we talk about magnesium. And they say, "Oh, I already tested it and it's perfect." And it's always the serum magnesium that was tested. And yeah, I mean, your body will do a lot of things to keep the magnesium in your serum just right. Like, it will pull magnesium from your tissues to keep the magnesium in your serum correct. And if your serum magnesium is off, you've got some like real problems. By the time that blood test shows that something is off or shows that your levels are low, you have real problems. It's too late now. This is now a problem that you're not going to fix by taking some magnesium supplements. So I don't know why they test the serum magnesium. It must just be like, I'm assuming that we're just looking for like outright damage control. Do we need to think about admitting this person to the hospital soon? Are we looking at kidney failure?
I think they're just I think there's just a disconnect. And while physiologically this is very true, it hasn't made its way into the system yet. Because anytime we have new scientific research or models or information, the medical system has so much red tape and so many barriers for that information to actually get incorporated. It takes decades. So I don't think that it's like with the testing CRP versus high sensitivity CRP. I think they literally just don't know.
Maybe they're just like working off of click a button. This is the list of labs that you get every year, right? This is your regular yearly lab work. And here we go. And it's testing the extracellular magnesium. This is a magnesium that's outside of the cells. And yeah, they just don't know. I'll buy it. But so what we like to do is test red blood cell magnesium. This will test the magnesium content inside of red blood cells. It's the inside the cells, intracellular. So what it will show is a small slice of the intracellular magnesium that's closer to tissue status than serum magnesium. So this is going to be a better indicator if you have body aches, fatigue, if these things could possibly be due to a magnesium deficiency. The red blood cell magnesium test is going to be a much better indicator. It's a little bit more expensive, but I was just looking at this yesterday when we had a discussion with our colleagues about it. And my wholesale price for a serum magnesium test is $4. And my wholesale price for a red blood cell magnesium from LabCorp is $10.
It's nothing.
Yeah. So my client's paying $20 for a lab test, or they're paying $8 for a lab test, and the $20 lab test is more valuable.
Yeah, the $8 lab test tells us no information. So
Well, it tells us that you don't have kidney failure, which is good to know.
well, and just to expand upon this, 1% of the body's magnesium is in the blood. 1%. And less than 0.3% is in the serum. And that's the part that we're talking about that regularly gets tested. The rest of the magnesium is stored in cells and tissues and bones and muscles and nerves. And our bodies pull from those places to keep that 0.3% perfect. But it's just such a lousy indication of how much magnesium is in the cells and tissues and bones and muscles and nerves.
The dumb blood test for a healthy person to get. That's just all there is to. I mean, if I'm not trying to be politically correct, it's just dumb to test for that. Unless if I go in, I'm perfectly healthy and I feel good, and we're just testing to check for some possible underlying deficiencies, like that is not a test that I need. In fact, that $8 blood test is a waste of my $8.
Yeah. Staying on the lab marker theme, let's talk about how we treat vitamin D in this country.
Oh, I have a list of all the things that your body needs vitamin D for. Can I read it?
Yeah, let's hear
Like
it.
your body cannot do these things without vitamin D. Absorb calcium and phosphate for strong bones and teeth. Mineralize growth plates in children. Excess PTH and bone loss. Maintain muscle strength, balance, and coordination. Turn on antimicrobial peptides to fight infections. Keep immune responses balanced by not overreacting or underreacting. Support insulin release and insulin sensitivity. Help regulate blood pressure via the angiotensin system. Maintain healthy skin barrier and hair follicle cycling. Heal wounds. Support collagen formation. Protect the gut barrier. Support heart and blood vessel function. Limit vascular calcification. Aid lung airway defense against pathogens. Support brain development, neuroplasticity, and neuroimmune balance. Support reproductive hormone production and fertility. Enable healthy implantation and placental function in pregnancy. Mobilize calcium for breastfeeding. Guide normal cell growth, differentiation, and cleanup. And support mitochondrial function and oxidative stress control. So if vitamin D isn't optimal, every one of these systems is working with the brake on.
Vitamin D is important. So when your doctor tests the vitamin D levels, they're looking for a range that's between 30 and 35 nanograms per milliliter. This is the range that says you do not have rickets. This is not the range that says you have enough vitamin D in your body to complete that lovely list Alicia just shared. When Alicia and I interpret lab work, it's not to diagnose or to treat or any of those things, we look to see, is this person's lab ranges in a place that allows them to function optimally, to feel good, not just not have a pathological disease. So if your vitamin D is over 30, your doctor's 2 thumbs up, good job, killing it. And Alicia and I, if you come to us with lab work that says your vitamin D is 30 or 35 or anything under 75, that's the first thing we're going to do with you.
Yeah. I had so much, oh, my vitamin D is great. It's 48. And I'm like, yeah, you can have a lot of pathological dysfunction with vitamin D of 48 that will go away if you get your vitamin D up to 75.
It's low-hanging fruit. It's easy. Vitamin D is cheap. So I think what shocks me is what a disparity there is between how we look at vitamin D and how the conventional medical model looks at vitamin D. And just you and I know, even personally, I think you and I have hit some low vitamin D levels. I moved to the Pacific Northwest where there's no sun. Oops. So I have learned firsthand how important this marker is and how much better people feel in life if you can dial in this one thing.
And I supplement with vitamin D. And I actually take more in the winter than I do in the summer because I live somewhere where there is a lot of sun and we have long days and I'm outside a lot, but I do feel that I need more in the wintertime. And the bottom line is, even lab tests aside, if you're not running around outside naked 8 hours a day, you're vitamin D deficient.
Should we all just be running around naked 8 hours a day?
I think it would solve a lot of the world's problems.
The world might be a better place or a worse place. I don't know.
Gosh, I'm going to make a bad joke because low-level vitamin D is tied to mood disorders. And there's a lot of that. But no, definitely we need sunlight and we need vitamin D. And yeah, look at those ranges, look at those numbers. Don't just look for on any lab test. There's a difference between functional and normal. And if you look around, I want to be more functional than the average person that I see. And the normal range is the bare minimum to not have rickets or not have scurvy in the case of vitamin C.
Yeah, we need to strive for more than just not having rickets.
Let's be more ambitious with our labs, y'all. Okay. Are we going to talk about, we didn't talk about CRP. We don't even need to get into that.
I was going to say, well, and I'll mention this when we are talking about lab work. Because a lot of times when people work with either one of us, sometimes they want to go to the primary care doctors to run lab work because their insurance will cover it, which is great. I'm a big fan of that. If your insurance can pay for it, do it. So I send people a lab wish list and I say, give this to your doctor and tell them these are the labs you want ran. And some doctors are great. Some doctors aren't as great. And it's not the doctor's fault because one, they won't run labs that they don't understand. And they are using a set of labs that they're used to. And this is when they order this lab in this situation. And so us prompting and asking for labs outside of that situation, one, sometimes they might not be able to justify it. I don't have anyone to answer to. They have to answer to the insurance companies. They have to answer to their medical boards. They have people to answer to. So if they don't understand a lab marker, you might not get them to run it. And if they can't justify the lab marker because they interpret the situation or the body in a different way than, say, Alicia or I would, then they also might not run it. And it's not to get mad at them, and it's not to think that they're incompetent. They're just working with a different set of tools and a different paradigm that doesn't allow them to be as nimble with the lab work. And one area I often see is I will ask people to go get a high sensitivity C-reactive protein lab marker done, which is a great indicator of just overall inflammation in the body. And they check CRP because they don't know the difference. And what does CRP tell us, Alicia?
What the standard CRP measures is inflammation. Okay. And high sensitivity CRP measures inflammation. It's the same protein, The difference is that the CRP flags big inflammation like infection, active autoimmune flares. So it's used to diagnose or track acute inflammation and serious illness, where the high sensitivity CRP is the same protein, but it's a more sensitive method. So it's more sensitive. It can read low grade chronic inflammation, that silent inflammation that we're really want to track because you could feel good in 20 different ways and feel just fine, but have silent inflammation in your body slowly giving you cardiovascular disease. And that's what high sensitivity CRP is really good at detecting.
CRP, which is the standard marker that is checked, is for the acute emergency, right? Like we are in a big medical situation. We're going to test this to see what's going on. If you're in your primary care doctor's office, that's a useless marker because there's no medical emergency. We're looking for the underlying, this is low grade, this is under the radar inflammation that we're trying to catch. We're not trying to catch, are you having a heart attack in this moment?
Yeah. The standard CRP is more, do you need emergency care right now? Say if your body is a car, I'll say that the standard CRP, you don't even need that test. Your car's already broke down on the side of the road. The HSCRP is the check engine light. That's your high sensitivity CRP. That means maybe take a look at something, change some habits. That's what you want from your primary care physician.
Yeah, in that situation, like you said, the CRP is not very helpful. We're looking for something different, but there seems to be a disconnect in how everyone views the world when it comes to that lab marker. And I've even seen some functional lab panels that are out there testing CRP and not testing the high sensitivity CRP, which I think like along the lines, people's wires have just gotten crossed and people think they're testing one thing and they're not. And so this confusion isn't just in the medical world with your doctors. I have seen it in the functional medicine space, which has really just dismayed me, but that's a topic for another day.
Yeah, and I think that it's just one of those things that CRP was, again, something that I was talking to people about 10 years ago, and no doctor would order it. There were no functional medicine doctors ordering it. Now I find that doctors are much more willing to order it, but also likely to order the wrong one. And the same girl who had the good magnesium had asked her doctor to have her CRP tested, and the doctor tested the standard CRP. And I'm like, that's great news. You did not have an active acute inflammatory condition in that moment when you got your blood drawn. Good to know, but that's the wrong marker. So I think that it's just something that isn't quite understood yet. Like it's on the radar, which 5 years ago wasn't even on the radar. So we're moving in the right direction.
Which is good. That's a win.
So labs, magnesium, vitamin D. We're running short on.
Okay. I was gonna say liver, but I think organ removal is fun too. The liver could probably get its own episode.
That's what I was thinking. We can call it something like the liver lover episode or something. I don't know. Sounds a lot of opportunity for a play on words.
They just be yanking things out.
They just, yeah, dude, like they just be yanking people's guts out for real.
I did a. Oh,
Go ahead.
I did a talk this week on hormones, and I did a little extra research on some gynecological stats and how we treat reproductive issues in this country. And 1 in 3 women by the age of 60 have a hysterectomy.
Yeah.
250,000 of those. Oh, so like it's about 600,000 a year. Of those, about 250,000 are for fibroids. Like, how easy are fibroids to treat? And we're just yanking everything out.
And I'll give you this, because here we get down to something that, gosh, we could probably talk for hours on. Utter disregard of the idea that we can restore function and rebuild tissues. Like, you and I know that. You and I know that if somebody comes in and they have an organ that's not functioning properly, or if they have tissues that are gone or depleted, that we can do things to restore function and we can do things to rebuild those tissues. when you have fibroids and you go to the conventional medical model with your fibroids, they do surgery to cut out the fibroids. And then the fibroids just grow back because we haven't done anything to restore that function and bring the body back into balance. So they keep growing back, keep growing back, keep growing back. So since we cut out the fibroids 2 or 3 times, now it's just time to take the whole uterus. Because if the only tool you have is a hammer, everything looks like a nail.
No kidding. Well, and it's not just uteruses that we're moving, which, and you know, when I looked into hysterectomies a little bit more, and I was like, 1 in 3 women have these by the age of 60. My God, are we considering the side effects? Like, the uterus is a structural organ in the body, and when you remove it, you have structural issues. There's urinary issues, there's postural issues, there's hormonal issues that come. There's a longer list than I can spout off the top of my head, but it's just shocking to me that that is just such a go-to procedure, not to mention just like how that feels on a spiritual level to have your uterus removed.
Gosh, the body is so amazing. It was designed the way it is for a particular reason. And we store things in our cells. And we could get deep into the weeds of how every organ holds particular emotions and has spiritual functions. And we're removing all kinds of stuff. I put together a short list. In the US per year, 700,000 people have their gallbladder removed. Was it 560,000 people have tonsillectomies? 90,000 people have prostatectomies. That's where the removal of the prostate. And then 10,000 people get their radical cystectomies, bladder removals. And you already said it was about 600,000 people a year get hysterectomies. So we're just pulling things out. And I can speak to the hysterectomy aspect because I'm a little bit older than you and things are changing in my body. And it was, I think, in 2023, I went to CKP because I was having some like perimenopausal issues and I was having some dysmenorrhea. I was having really painful, really heavy periods, pretty extreme PMS. And I started to really get on a very strong herbal regimen for that aspect of my health. I had a good friend at the exact same time. Like she and I would speak about it. We had all the same issues. There wasn't a symptom that I had that she didn't have and vice versa. I went to see KP Khalsa. I got on an herbal regimen. She went to her primary care physician. 2 years later, I have 0 symptoms. My cycle is regulated. My bleeding is normal. And she's had a hysterectomy and has complications from the hysterectomy.
That makes me sad because I don't know that people know that alternatives exist and that any of these surgeries that you just mentioned, gallbladder, tonsils, hysterectomy, prostate, bladder removal, depending on the situation, most times there is something that you can do naturally that will change your outcome and make it so you do not have to have a surgery, especially the gynecological issues. I would have to say that most hysterectomies are probably very avoidable.
I would agree. You said half of them are for fibroids? How many of them?
It was just shy of half.
Just shy of half. Because we know there are things that you can do with herbs that will make fibroids just shrink and go away.
Fibroids are easy. It shocks me that they don't have tools to deal with fibroids. And so they go, okay, bye.
Well, they do have a tool.
Take it out.
They have a tool. That's their tool.
They need a better tool.
I mean,
they need a bigger toolbox.
We have better tools. And I think that we see this a lot. Like we talked about this ad nauseum over the weekend about gallbladders. If you have gallstones, it's painful. And we can use herbs to stimulate bile production, to wear those stones down the same way water flowing in a stream wears down the stones of the river. It takes 6 months, maybe a year, maybe less, maybe more, depending on the person, depending on how disciplined they are with their regimen, depending on what else is going on in their body. But it can be done. And during that time, they still may have some gallbladder pain from here and there. And it's easier for a lot of people to just remove your gallbladder. But to me, that kind of freaks me out. Like, my gallbladder is really important to me.
Well, it's not like it doesn't do anything. It's a digestive organ. It holds our bile so we can digest our fat, and it's there for a reason.
Yeah, it's important to me. I want to keep it.
I given the choice, I feel that way about all my organs.
Yeah. I'm sure that men feel that way about their prostates. They don't tell you about some of the side effects of a prostatectomy. It's a really hard thing for a man to go through. Just like a hysterectomy is a really hard thing for a woman to go through. And the tonsillectomies, I think there could definitely be some social commentary there on why we just take children's tonsils out instead of doing things to build their immune systems.
Because it's easier. Okay, sorry.
And that being said, just, I don't know. I don't want to shame anyone who's had their children's tonsils taken out. I don't have children. I've witnessed how difficult it is to deal with sick children and get them to take medicine. There's like a lot of weeping and gnashing of teeth at my sister's house when it's time to take anything. So I could see how a surgical intervention and not having to do that again for a sore throat could look like a really viable solution.
And I think the biggest thing is, and I think it's probably true for most of these surgeries, is people just don't know that there are alternatives.
Exactly.
People forget that the tonsils are there for a reason. They're part of our immune system. And sure, are you going to live a fine life without them? Yeah, probably. You might get sicker more than the average, might take your immune system down a couple points. But at the end of the day, it's not going to ruin your life, certainly. But I think people just don't realize that these things can be corrected. I think that's what it comes down to.
Yeah. Prostate swelling can be corrected. Fibroids can shrink and can stop growing back. Gallstones can be worn away. And lifestyle changes and body functioning can be restored so that they don't come back. Like, all of these things are possible.
100%. 100%. I'm just picturing they just have like buckets of organs sitting in the basement, just like a little bucket of gallbladders, and here's a bucket with all the uteruses.
Oh,
Just organs
that's morbid.
everywhere. Besides, I was just thinking, what do you do after you take out the organ? You just throw it in the bucket with the rest of
I
them.
don't know what they do with them. They
Dog
give them
food?
to the wealthy
That's terrible.
elites.
Edit that out.
She says, edit that out. That's what they... Okay, we could go on. There's more we could talk about here.
That's probably enough ranting for the day, though.
Yeah, I think that's good stuff. I think we've given people some good information. We did talk about this. I want to do a little teaser here because it came up as we were exploring this episode. We were talking about doing like a vitamin label reading episode where we really walk people through how to look at the labels on your vitamins and supplements and make sure that you're getting exactly what you need and getting the right amount of the right type of supplements. And I think that will be really beneficial, and I hope that you guys will enjoy it. And it might be for our listeners on the podcast apps to actually tune into our YouTube for that one. We'll keep you guys posted.
That's a good idea. Yeah.
In the meantime, thanks for doing this with me, Lila.
Yeah, thank you. And I hope everybody enjoys daylight savings.
Are we saving daylight? I just know it gets dark earlier. Y'all have sweet dreams.
We put on RRR last night.
Oh, did you?
So good. But I was like thinking it's 10 o'clock at night. I'm like, ooh, I'm watching a movie at 10 o'clock at night. It was like 7.
I went to bed at 8:30 p.m.
Messing with my head.
Yeah, well, we'll get used to it. In the meantime, guys, thank you so much for listening and, yeah, putting up with our rants.
We'll see you next time.
Bye.
Thanks for tuning in to Herbalism Uncensored. We're genuinely humbled by the love and support you've shown us. If you've been enjoying the show, be sure to subscribe, leave a review if you feel called, and don't hesitate to reach out. Whether it's with a question, a success story, or a topic you'd love us to explore in a future episode. And remember, both Alicia and Lila, that's me, run virtual clinics. We'd love for you to check out what we're up to. You can find Alicia's practice Holistically Correct at holisticallycorrect.com, and you can learn more about my work at the Virtual Natural Healing Clinic by visiting tvnhc.com. Until next time, be well, stay grounded, and keep healing.